Professor Nancy Baxter is an epidemiologist and the head of the Melbourne School of Population and Global Health at the University of Melbourne, and can join us now with her reaction. Professor Baxter, welcome to Drive.
Thanks for having me.
There is so much out of today's announcement, but one thing that I was interested in is removing the requirement to get a PCR test to confirm a positive rapid antigen test. The government's saying it's going to reduce pressure on the lines and make sure results are coming back quicker. The question I have, though, out of that is how records going to be recorded of the virus moving throughout the community. PCR tests has been the point of record really for positive cases. Are people going to have to share their rapid antigen tests with the government, or are we just going to lose track of who has COVID in our community?
Well, there's certainly countries that do have the infrastructure, the information IT infrastructure to allow recording of your rapid antigen test. And that may be important for some people in terms of being able to take time off work and that sort of thing, or get benefits. And I know that Victoria is talking about developing a system like that, and it's doable, and I think it should be done. But obviously, it's not something that can be done by tomorrow. So I think eventually we'll have a system when people can inform the government that they have a positive rapid antigen test. But I do think that having we're very used to wanting a precise number, the precise number of cases, because we were trying to have control over COVID to try and get it to the lowest number possible. I mean, right now that horse has left the barn. And so what we need to do is have an idea of where we're at with COVID in the community, but we don't need to know precisely each case. So I think that while I am very supportive of having a system where you can report your rapid antigen test so you have a good idea of how much there is in the community, right now we probably have multiple times as many cases as are reported with PCR. So, cause we're just under testing, under reporting. So I don't think that we can count on having a precise number right now. We can't.
And I suppose then, as far as what you've heard from the Prime Minister there, schools going back and to stay open, move away from PCR tests and a move away from the requirement to test a lot in the community. What do you think that's going to do to the spread of the virus, and also, I suppose, the wait times people have been experiencing as well?
So, I think we need to, we've reached capacity in terms of PCR, so there's really no more PCR tests out there. So I think that is a challenge we have, and, we have world-class kind of access to PCR. We have more PCR here than in many, many, many other countries. So I do think we need to figure out other ways to monitor for the presence of COVID. And it's just unfortunate that we're now reaching this crisis and we don't have adequate rapid antigen tests. In terms of schools going back, again, it's a bit, again, we delayed the vaccination of children, 5 to 11, to be sure that we were as safe as possible. But in doing so, what we've done is delayed it so that, really we're kind of behind the 8 ball now, and we'll be sending kids 5 to 11 back to school without being fully vaccinated. So I do think that we have to keep in mind that there is a potential for spread at schools, and that, people at school do need to be protected. So children generally have very mild disease, which is excellent. But when enough children get it, which surely they will when they go back to school now, if enough people get it, even if serious disease is rare, and rare doesn't mean zero. So if you have a large number of kids getting it, we will be seeing kids getting sick from it. And so, I think these kind of statements like we want to get children back and not have schools opening, closing, I think it's good to aim for that, but I do think it's really important not to be dogmatic about these things, and to kind of just see how things go, and to deal with what actually is happening. And I'm just afraid the rhetoric just means that they're not going to be willing to do that, that it's just so important to them politically to have schools open and to keep them open that they're not necessarily going to do what is best for public health. that's one of my concerns about all of the things happening right now.
We're speaking to Professor Nancy Baxter, an epidemiologist. I can't believe I can't say that word yet after all of these years, about the announcement from National Cabinet today. A lot of changes coming away in how tests are conducted, what your requirement is for testing, announcements on access to rapid antigen tests for concessional access, really, a 3-month period, 10 tests over that 3 months. People can go qualify to chemists to get those tests. 1300 222 774. Would like to know what this means for you, how you're feeling about these changes. 1300 222 774. You can also text 0437 774 774. Professor Baxter, with a move away from so much requirement from testing, and we don't know what it means for reporting of the virus yet and what that means for recording of the virus in Australia, is this a sign, and at a time, I should say, of New South Wales having 35,000 cases today, Victoria 17,000 cases, is this a sign that governments will be giving up in the overall control of the virus and, well, just managing the spread in the hospital system rather than the absolute numbers about how the coronavirus, how COVID is moving through the community?
Well, certainly listening to the press conference, at least the first part of it, I had the sense that really, despite saying that a lot of changes had been made, and a lot of changes have been made, largely they were about window dressing. They weren't about anything that was actually going to change the direction of the Omicron wave. So you certainly did get the impression that basically the plan was just to continue as is. And I think that is so wrong, because what you're already seeing is the hospitals starting to get under pressure. And as the cases go up, that is going to get worse. You're seeing a lot of physicians and nurses who are in isolation or quarantine. Now they're talking about having those people come back. So having someone with active COVID on the wards, I mean, that is going to lead to further spread of COVID within the hospital professionals, but it's also going to likely result in spread of COVID to patients. So I think you're heading to a point that we never wanted to be in this pandemic, and I know that this is part of Omicron being just so much more transmissible, but it does seem remarkable that you're making these changes and talking about making nurses and doctors go back to work sick, people, workers at aged care going back with COVID to care for elderly people. And you haven't put in place any restrictions at all to try and control the spread. So this is, I think, a lack of leadership. We will see more Omicron here than almost anywhere. That's my prediction.
Are you worried then about the next few months?
I am very worried about the next few months. I mean, right now, you go to grocery stores, you hear about grocery stores in New South Wales with poorly stocked shelves. You hear about supply chain issues. You hear about the emergency rooms and hospital wards. We're talking about stopping elective surgery in Victoria. These are not normal times. These are times where we need to put things in place to try and control the spread. We have currently, I think the only density restrictions we have are for events more than 50,000 outdoors. So, this is not sensible. We are not kind of in a world that's making sense right now. We need to start taking this seriously. This is not living with the virus. This is giving up on the virus. And we're going to be in real trouble if we don't take this seriously.
Professor Baxter, thank you very much for joining us today.
Thank you.
That's Professor Nancy Baxter, an epidemiologist and the head of the Melbourne School of Population and Global Health at the University of Melbourne, saying there that we might have more Omicron here in Australia than anywhere else in the world. Her warning under the changes announced from National Cabinet today.